and thank you, Ranking Member Scott and Secretary Becerra. It's really nice to see you. My constituents and many across America have been the importance of access to telemedicine during the pandemic. Innovation and flexibility in healthcare policies are a win for Americans. Americans had more access to telehealth services during the pandemic, and this expanded service was very popular. We then sadly witnessed the loss of telehealth services for those who have high deductible health plans coupled with health savings accounts on December 31st, 2021. Fortunately, the relief was reinstated on April 1st, 2022 through the end of the year. While this is a small victory, the coverage provided by the omnibus legislation is temporary. It won't cover the first quarter of 2022, leaving employers with uncertainty about how to handle claims for that period. Again, it is important to note that 30 million Americans lost access to healthcare for 4 months, especially for virtual primary care and behavioral health services. From those who cannot afford to pay $7 at the gas pump and drive to their doctors, or are a single parent, cannot afford to leave their child at home, virtual care is an important tool in the tool shed that will lower cost and expand access to care. This is why we need permanency in telehealth. With this in mind, Secretary Becerra, as you know, 50% of individuals with an HSA savings in a zip code where the median income is below $75,000, do you agree that families and individuals with high deductible health plan coupled with the health savings account should have access to first dollar coverage of telehealth services?
Congresswoman, I think we've seen the value of telehealth as a result of this pandemic. We are appreciative of the work done in Congress to pass the omnibus bill, which gave the 5-month extension on some of the authorities to have flexibility with telehealth. We hope you work hard to extend some of those authorities permanently. Meantime, we're going to continue to do the research that will give us the answers to how much telehealth we can absorb and do right, because we want to make sure we're accountable. Once you start to remove the actual presence of the patient and the provider, there are a lot of folks who are going to try to game the system, and we want to make sure that doesn't happen, because telehealth has become too precious a service for so many Americans who rely on it now. And so we are absolutely committed to working with you to extend permanently coverage of services, for example, where the patient's home is considered the originating site. That's something that is not permitted right now without the extensions of telehealth authorities that you've given us. We want to make sure that community health clinics, federally qualified health centers, and rural health clinics can continue to provide services at distant sites. There are so many things about telehealth that we've learned. There's still much we have to do. The more that we have the evidence and the data to help us make sure that we're all accountable and that no one is gaming the system and taking taxpayer dollars without really providing a service, the better off those patients will be. So we're very much looking forward to working with you on anything having to do with telehealth.
Thank you, Secretary, because that was my bill with Congresswoman Susie Lee. We worked together. We tried to make it permanently, but it just had the extension. So you know what? We are going to make this one permanent, and I'm very glad to hear from you that you agree that it has to be permanent. How is the department approaching and analyzing telehealth policies like these to extend beyond the current public health emergency and after emergency?
I think I heard the question. I know it deals with the public health emergency and the telehealth authorities. I'm going to venture a guess at what I think you asked, and we have the authority to expand access to healthcare services through telehealth, because during this public health emergency, we were able to do things to stretch the laws legally in ways that allowed America to take care of all of its people during this pandemic. But once the public health emergency expires, once I remove the declaration saying we're under the state of a public health emergency, those authorities, the liberalized authorities that I was able to extend to the American people, go away as well. And so the sooner that Congress moves forward to change the statutes on telehealth to give us that flexibility in the areas where we've seen tremendous success, the better off the American people will be.
Thank you, Secretary Becerra, and I yield back.